Hi guys, it's Dale with the insurance. This week we're going to talk about it's a coverage that's quite important. It's quite timely, um, and that said, it only applies to those in a particular situation. So it's health coverage, and trust me, I know it can be very, very confusing, especially in light of all the legislative changes that have come down the pike in the past kind of decade or so. The most important being obviously the ACA, the Affordable Care Act, quote unquote Obamacare. But the title of this article is actually child only health insurance coverage, right? So it's something. I mean, obviously, it's those people who who have a child or is the legal guardian of a child, and it's peculiar because you can find yourself. There's an example in the article that's a really good example that people don't really think about, but there are several others that this can apply to, whereby you have an adult who literally is just not looking for family coverage or coverage for themselves, but coverage for a child in which they have the responsibility to take care of, right? In the example in the article, it's kind of a grandmother or grandfather whose child has been incarcerated, has a child while being incarcerated, doesn't want that child to go through the system, so they adopt that child, right? They have Medicaid Medicare, because they're at retirement age, they're a grandparent, but Medicare doesn't accept, I mean, that's for older individuals within our society who have already contributed by working their entire lives to our society. So it doesn't accept children. Fair enough. In such a case, that grandma or grandpa would be looking for a child-only health insurance policy. Now back to what we know about Obamacare. It was signed into law 2010, really changed the game, and has been the most recent all-encompassing legislation that has impacted the healthcare market. And those rules obviously apply to child-only healthcare as well. Namely, carriers can't deny coverage for pre-existing conditions. Children can remain a dependent, which is a key factor. Children can remain a dependent up to the age of 26. Before, it was dependent on the state, 18 or 21. All health insurance is standardized, and every state, including DC, has kind of a marketplace where you can find these policies, right? And by now, most people are kind of familiar with the tier system, right? You've got silver, you've got bronze, you've got bronze, then silver, then gold, then platinum, right? And the vortex of these different levels of coverage is that the cheaper ones are matched with the lesser amount of coverage, which is the bronze, and then all the way through platinum, which is most expensive and has the most coverage. Same for child-only policies. The keys here are that now that these policies are standardized, you'll find the bronze policy, which is the cheapest. The bronze policy in kind of Illinois will be very similar to the bronze policy in Florida or California, but the pricing can be different. Okay, so that's kind of where the variety lies, right? Now, depending on your situation, it may be more advantageous for you to simply add the child to your current policy. That is typically the cheaper option. But if that is not advantageous given your situation, there are child-only policies that you can obviously purchase. And once again, the same characteristics and traits apply. Those bronze child-only policies will provide 60% of the coverages, but will be the most reasonably priced, right? And by coverages, it covered kind of like your standard immunization shots. Typical coverages include ER visits, things like that, but they will not include specialized services that may have to do with vision, hearing, things like that. So if the child does have specialized care, make sure that when you're going out to look for these coverages, you make sure that it is included in the plan that you're considering. And just like any other coverage, you can go to kind of the private market, private insurance carriers within your state to look for insurance, or you can go to the marketplace, right? Another factor to keep in mind when you're looking for child-only policies is that the parent or the legal guardian is the only person that will have full access to that child's medical records. That's typically the case in every state. Are there any other takeaways? And the article also has kind of at the bottom a nice summary of all of these things, because it can be so convoluted and so confusing. But those are kind of the salient takeaways. For one, child-only policies exist. Typically, it's more price conscious. It's cheaper and better to just add that child to your current policy. You can do that up till 26 now. The coverages are standardized, so the between tiers. So the tiers, the type of coverage will be generally the same amongst different states. Pricing may be different, but generally the coverages will be the same. And then coverages are for things like immunizations, ER visits, stuff like that. That's generally the case. So thanks for stopping by, guys. Hopefully this was helpful, and we'll chat next week. Bye.